at least 8 meat processing plants in Nebraska have confirmed coronavirus cases, including one really, really big outbreak. At least 237 cases of coronavirus now tied to one beef plant in Grand Island, Nebraska. Grand Island's the 3rd largest city in Nebraska. The cases tied to that one beef plant in Grand Island account for more than 40% of all the cases in that area. But neither that plant in Grand Island nor any of the other Nebraska meatpacking plants with confirmed cases has been closed. And Nebraska remains one of the few states in the country without any kind of stay-at-home order. In recent days, the rate of coronavirus cases around Grand Island, Nebraska, has been higher than some of the hardest hit states in the country, higher than Michigan's, like it says in this headline, close to Louisiana. There are now over 600 confirmed cases and 18 deaths in the Grand Island, Nebraska area, including 4 deaths reported just in the past day. Grand Island's mayor and the local health director have been asking Nebraska's governor, Pete Ricketts, for a stay-at-home order, but he has refused. The local health director has warned that the healthcare system around Grand Island is very close to being swamped. She said 2 days ago, quote, "We are going into a rather dark couple of weeks." Joining us now is that health director. Teresa Anderson is the health department director for Nebraska's Central District. The Central District is right in the middle of that state, about a 2-hour drive away from Omaha. Ms. Anderson, thank you so much for making time to us tonight, for us tonight. I know you have a lot to deal with, and it's a very busy time.
Thank you, Rachel, for having me.
First, let me just ask if I characterized things accurately as far as you know, and if there's any other important developments that we should know about in terms of this, what appears to be a pretty sizable outbreak in and around Grand Island.
Yeah, you know, the outbreak is associated to some degree with the meatpacking industry, but there are a lot of factors that go into determining how severe the outbreak is.
We're getting a sort of a echo effect on your audio. I'm not sure if there's anything that we can do to adjust that. I know that technically this is always a challenge to do these things. I can hear you though, and let me just ask you. That seems like that might be better.
Okay, good.
Great. All right. Let me just ask you, it has been unusual, I think. I expected watching this from afar that some of the facilities where there's been a large number of cases associated with an individual workplace, that those might have been closed. But as far as I understand it, no meatpacking plants in Nebraska have been closed, including this one in Grand Island where there are a large number of cases.
So the way that it's been evolving is that our plant here in Grand Island has been, I'm going to say, ahead of the game, at least time-wise, in the number of cases. And I'll give you an example. Last week we had 360 cases in our 3-county area, and this week we have 630 a week later. So the spread is within the community, and we've known for a while that it's been community-wide. What happens in the meatpacking industry is that, and you well know this, that they're close quarters. People are working elbow to elbow. They're changing out into their work gear in the same locker room. And so there are lots of opportunities for the spread of virus. Certainly that was the case a few weeks ago. The meatpacking industry has been taking some measures to improve the distancing and the reduces the potential for the spread of virus all across the state. And most recently, DHHS has had some teams out looking at and advising the different plans on what they might do to better reduce the spread or the potential for the spread. I was watching what you were saying a few minutes ago, and in our instance, it may be that the cat's out of the bag, so to speak. We've got a wide spread of the virus, and at this point, closing the plant may be helpful to us. I certainly think it wouldn't hurt, but we've got spread everywhere. Literally, when we do our contact tracings, we know that while many of them are related to JBS in some fashion, whether the person worked there or their spouse worked there, they were also experiencing other types of outbreaks, especially around our long-term care facilities, which is, of course, very concerning to us.
in terms of that spread being everywhere, including, as you said, long-term care facilities where it's so dangerous, now that you're seeing the numbers that you are and you've got the amount of community transmission it seems that you have, I'm worried about your hospital capacity. Can you tell us anything about the number of facilities who are able to treat people who are very ill with COVID-19 symptoms, and tell us if you're worried about intensive care capacity and even potentially ventilators?
Right. So what happens when you get out into the rural part of the country is you'll find that some of the rural hospitals are critical access hospitals, and therefore they have no reverse airflow rooms and they have no ability to care for COVID patients while protecting staff. So in our particular district, we have 2 of those community access hospitals, and then we also have one hospital that's a larger hospital that has capacity right now with 17 ventilators. But what happens with us out in the rural part of the state, again, is that we have a limited number of staff. So even when we're able to bring in ventilators from neighboring or from some distance to facilitate the process, the staff isn't there. And I am an old ICU nurse from the old days, and I realize how technical the care is for a patient on a ventilator. And the folks that need to be brought in are going to be highly skilled individuals. So we have the challenge of bringing in folks into an area that's fairly active with COVID and then asking them to work in our facility, knowing that in our community there's a widespread.
Teresa Anderson, Nebraska's Central District Health Department Director, who has a bear of an epidemic there to be dealing with in that rural part of Nebraska. Thank you for talking publicly the way that you have to explain to people the seriousness of what you're facing in Grand Island. Thanks for helping us understand it on a national level. And please keep us apprised as this is going ahead. I am worried that you're in for a few weeks of very dark days. And to anything that we can do to let people know nationally and to get you any help that we can, please let us know.
Thank you, Rachel.